So I wanted to talk to you guys about what I feel is the biggest problem in internal medicine these days. And the reason I was actually thinking about this is actually really random. The last couple of days, I've been editing this family vlog, and it was really satisfying to me. I'm not that great at editing. I'm not that fast at it, and I've definitely spent way too much time on it. I'm learning this new software called DaVinci Resolve. But I feel like there is something that is very satisfying about doing something with your hands per se and creating something or making something. I think humans in general, we're kind of wired to want to do something with our hands, and it's really tough now because everything is kind of technological. So I know this editing thing that I've been doing was on a computer, but it's still, I was like making something. But this is the same reason that people really enjoy playing sports or doing yard work or woodwork or just doing something with their hands. And, back in the day, internal medicine used to be a lot more procedural. And getting a procedure is just one of the most satisfying things to do. I mean, it's like a very clear objective, and then you accomplish it. Recently, I've been doing a lot of peripheral ultrasound guided IVs for the nurses when they've had difficult access. It's actually really nice because, these nurses need this access, and to be able to help them out really quickly is very, very nice. And it's basically like an A-line, but a little easier because you don't have to like suture it in and everything. Obviously your target is very small, but it's kind of like a fun little challenge. So I would actually encourage you guys to do that. But yeah, editing this video, I was like, wow, I'm really enjoying this process. And in internal medicine, the big problem is that over time, we've lost a lot of those procedural skills. We've started to defer them to other specialties. And I think it's becoming this sense of, we're becoming more thinkers rather than doers. And yeah, I like to be a thinker and I like to be a doer. I don't want to just be one or the other. Like, I don't think it's great if you're just a doer and you're not like actually thinking about what you're doing. That's one of the best parts about internal medicine is literally like actually getting to think about the problems and figuring out the physiology of why this patient's doing bad, looking at the evidence and choosing the right treatment. But so much of our time these days is spent behind a computer. And I think it's probably hit like all the specialties, but probably disproportionately has impacted internal medicine because of how long our notes are, how many problems our patients have. And by doing, I'm not necessarily just saying procedures because, you don't have to be doing procedures to be doing something. But like going and taking a history and talking with patients and counseling patients, I consider that all doing. And because of the burden of documentation that we have recently, so much of it is thinking and documenting. We're not doing things anymore. And that's the biggest gripe I have with internal medicine these days. When I think back to my image of what an internal medicine doctor is or was, is they were a doer. They're talking to patients, doing procedures, doing some documentation, communicating with other specialists, but they weren't just like sitting behind their computer all the time. And that's unfortunately what the specialty kind of, is spending a majority of their time doing at this point. And that's why we've lost a lot of our procedural skills too, because as you create these generations of physicians who graduate residency not, confident in procedures, then they're not going to teach their residents to do procedures. And more, you're going to have to defer these procedures to more subspecialized people. And you get these situations where like the ER is like, wow, how come like sometimes you truly can feel like our specialty has kind of been neutered. Like you used to be this like very well-rounded physician who could do all sorts of different things. And now you're kind of like, at sometimes you might consider yourself, I feel just like I'm a note monkey or something. Now the question is, what are we going to do about it? I can't believe this whole like conversation in my own head was just spurred on by, editing this family video the last couple of days. But I don't know. I just wanted to share this with you. But what are we going to do about it? I think the key is, one, we have to become more efficient. We need to optimize our workflows. We need to spend less time documenting. So whatever you can do to get yourself to finish those notes more quickly. And they don't have to be perfect. I really don't think they have to be perfect. But the earlier you can get them in, the earlier that consultants can read them if needed and figure out what your plan is. And the earlier that you can actually start doing other things. One of the things I actually really enjoyed doing recently, Dr. Shuba, if you're watching this, I've been going down to the nephrology clinic a lot recently. But even just like getting the patient's urine and spinning it and looking under the microscope, I consider that like an action. Like we're actually going to do something physically in like the physical world rather than just like reading, the EMR all the time. And for me, that's so fun. Like that's one of the most enjoyable things for me to do. I feel like for any of you residents out there who are struggling with this feeling of feeling like you're just sitting behind a computer all day and not really doing much and just documenting all day, it's something that we should prioritize is like maintaining that skill set of, doing urine microscopy for ourselves, even like blood smears and taking a look at them. I haven't done that much, but that's definitely another skill that I think we should have. And doing basic procedures, ultrasound guided IVs for the nurses, like all of this stuff is great. And then spending more time talking to patients too. Again, based off my last video, I don't want to make it sound like, oh my God, I'm just crushing it. I'm just typing all my notes really quick. And then I'm just like talking to the patients all day and doing all these things and placing central lines and everybody. I'm definitely not doing stuff like that. But like, I think having that basic skill set is something we should try and maintain through residency, and I encourage you guys to do it as well. I also wanted to say that obviously this has to be within reason. Like, we don't want to be doing things out of our scope, and not everything you're going to be comfortable with. Like, I haven't done that many INDs. They're very simple, but I probably, like, if some complication happened, I might not know. So that's something I need to work on in terms of my own comfort doing something like that. The other thing is, like, the other day, we had this Foley placement that we couldn't get. Like 5 ICU nurses tried to do it, and then I called urology and they were like, why don't you go do it? And I'm like, honestly, if 5 ICU nurses couldn't get it, who have been doing this for like 700, like do like 700 of these a year or something, how am I, who like did 2 or 3 of them in 3rd year of med school, gonna be doing any better than they would? And they gave me a lot of pushback on that, and maybe I should have just gone and tried to place it myself. But like, seriously, I feel like in those situations, the nurses have much more experience placing Foleys than we do. So I don't feel like me trying to attempt and like causing additional urethral trauma to the patient is really going to help out that much. But everybody's got to develop their own style at some point. But again, I'm not advocating for us to like go out of our scope or do all these like crazy things. And like, I'm not saying that I'm not on the computer ever and I'm just like running around the hospital doing all these like weird things all the time. So, we need to optimize our workflows. We need to continue seeking out procedures, doing urine microscopies, doing random things like that, maintaining our skills as internal medicine doctors. Like, I don't want us to be these note monkeys and have our profession just like go down the drain slowly to all these like subspecialists who will like do everything for us and we just like write the notes. Like, we should be the best possible, well-rounded doctor that we should be. And that's something I'm going to strive for. And, I'm not sure if I'm going to achieve that, but I will definitely try my best. Anyways, those are just a couple of my quick thoughts regarding the subject and the state of internal medicine as a specialty. I'm wondering what you guys think about the state of our specialty and, what we can do to maintain our skills. And do you even feel like this is a problem, or do you feel like, the way things are going, this is just like the natural progression of things? I'm curious to hear what your thoughts are. And thanks again for watching as always. I'll see you in the next video, and peace.